here we are, pandemic. We're a year in. I remember when we talked about it the first time. I got to go. I haven't posted up that video thing, but we've got that podcast up. I should go back and dig it out. We're a year in, and like you said, there is so much information out there. Different jurisdictions are dealing with things differently. You've got the drug manufacturer saying something. You've got governments countering that or being, leery. We see that right now with AstraZeneca and stuff. It's great. And then we've got different parts of the world using different vaccines and the EU is not necessarily using the Sinopharm vaccine from China, but Hungary is, and Hungary's part of the EU. It's like, okay, hold on a second. So how does that fit? Because they're saying, you know what? We're going with your the first words that came out of your mouth, and that was any vaccine is a good vaccine. So get some level of protection. It's like, man, where do you go with all this?
James, first of all, the UK is not part of the EU anymore. So Hungary and the UK are allowed to have different decisions now, which is very sad.
Didn't I say EU?
Yes, EU, as in like the UK. I thought you meant that the UK.
No, I meant the European Union.
Yes, but we're not. You know that we're not.
Yeah, Brexit. Yeah. I know you.
Oh, right. Yeah. I was going to say, James, you know everything. This is something that you would easily know compared to me.
But within that EU, it's a 26 country block now, right? I think it's 26. Yeah. So they've got their own sort of guidelines, and France and Germany and all those follow that, and they're even some of those countries are going, no, yeah, we don't agree anymore. So
it's a lot of confusing information, and I'd lie if I said that at the beginning when the vaccines came out, I wasn't apprehensive about the thoughts of a vaccine that had come through so quickly, and I had to do my own research into them to establish, hang on, is this something that I want my family to have?
Yeah.
And also, a lot of people have been coming to me to ask questions on which vaccine should I have? Should I get vaccinated? Will it affect my fertility? I'm pregnant. Should I get a vaccine? I'm breastfeeding. Should I get a vaccine? Should I give my children a vaccine when it's ready? Everyone's got questions. Yeah. Why has it gone through so quickly? And the main question now is less about should I have a vaccine, but which one should I have?
Sure. And there's, you've got the things like the Modernas and the BioNTechs and stuff that are really interesting, so experimental in what they're doing with them. In a sense, I mean, as opposed to our traditional vaccines, when we go way back to, the polio vaccine, we do have some vaccines that are still being made using that tried and true technology. So you got, differing technologies, what they do. What an amazing time to be around, and a confusing time. And then for you, because everyone's coming to you, I'm kind of old, I've got allergies, I've got this, I've got that, fertility, as you said. I'm glad I'm not you.
To be honest, though, a lot of it is just media hype. People jump on the bandwagon. So, for instance, let's just address infertility. There's a huge discussion going on in the mass media about, oh my goodness, how these vaccines are starting to affect fertility. And, should you take them if you think about getting pregnant? Maybe you should wait 3 months. That seems to be the thing that I keep hearing. And actually, when you do your research, there has been no vaccine ever that has affected fertility in the history of vaccines. From the reading that I can gather, I say that loosely because you can never say that with complete certainty. But from the big vaccines that we've used on a regular basis, they've not been shown to affect fertility. And again, this one, that's like saying the vaccine could make you purple, because yes, in theory it could. There's not been enough research to suggest that you can say it definitely can't, but there's absolutely nothing to suggest that it does either. And yet, for whatever reason, people have jumped on this bandwagon of, oh my goodness, I'm not sure if I can get the vaccine, I'm thinking about having a child. So it's very confusing, and there's an awful lot of contradictory information out there.
I got another one that I want you to address. The big word that everyone uses, and we hear it in government officials, we hear it in the media, efficacy.
Yes.
And there's multiple efficacies when we start, there's the overall efficacy, there's the efficacy of ending up in the hospital. I mean, can you talk to me about that term? What does it mean?
Yeah, so first of all, what people are looking at with efficacy is how well does the vaccine stop you from getting the virus? Now, remember, all these vaccines have got different types of trials. So how have they conducted the trial? Who have they conducted the trial on? What percentage of the population have they conducted the trial on? So when you're comparing one efficacy to another, it's not always like for like. And unless you are privy to all that information, or you've been on the websites and which actually it is available on the WHO website if you want to have a little look at more detail about the vaccines and how they've been tested. So unless you've really done your homework, it's very difficult to say this efficacy can be compared directly to this efficacy. Also, it's looking at, you don't know what does each individual trial mean, what is their definition of efficacy? So is it saying how many people does it stop killing? Does it mean how many people stop getting the virus? Does it mean how many people getting the worst strain of the virus or a more asymptomatic strain of the virus? What I can tell you is all the vaccines that are out, the current data suggests that every single one is 100% effective at preventing deaths from COVID. So that's a really important thing to take.
Right? Like that's the number that we want to hear.
Yes, exactly. So 100% effective in stopping, I was about to say killing deaths, which doesn't make sense, but you know what I mean, in preventing COVID death. Now, what it might not mean is, so for instance, let's look at the Oxford vaccine. It might be that that's showing sort of 65% efficacy. That may mean that you are still able to get an asymptomatic strand of the COVID. So yes, you get a COVID infection, but you're asymptomatic. You don't even know you've got it. It's not affecting you. It's not going to affect anybody else around you, apart from that they catch an asymptomatic strain. So it's not really something that is of great concern. The reason that we're having these vaccines is to effectively prevent death and ICU admissions and to stop the hospitals being overrun. So if you're none the wiser that you have COVID, which for instance, like I had it and I didn't even know I had it, then what's the problem? And yet you're saying, oh, I can't get that vaccine. It's only 60%, even though that is a much more tolerated vaccine than others.
Right. Okay. Here's another question. If you've had COVID like yourself, I mean, you had the virus, you had one of the strains.
Yeah.
Do you need to get a vaccine?
In theory, normally, if you've had something, they say you would not necessarily need the vaccination if you can prove you've got the antibodies against it. However, because this is a really new virus, the recommendation is that you should have the vaccine. There is talk, and it's early talk, of only needing to get one shot of the vaccine. However, as it stands at the moment, the recommendation is whether you've had COVID or you've not, you should still have both vaccinations. And that is just as it stands. And it's because there is not enough data to say that once you've had COVID, whether it's an asymptomatic COVID or a more severe strain of COVID, that you are going to have your immunity cells for long enough as well to last. So in theory, once you've had it, yeah, you should have your antibodies. Why get a vaccination? Or you might need a little boost with just one of the vaccines. But sadly, at the moment, it stands that you still need to have the two, which is a shame because it'd be great to think that's it. I'm done. I don't need an injection. And you know what? A lot of people are very, very needle shy. So they get very nervous at the thoughts of having a vaccination anyway.
At least it's a small needle. It's not one of those big, giant pen-shaped things. It's, like a gamma goblin needle. That thing's the size of a small... it's like you're tapping a tree to get maple syrup out when you get one of those needles. This is just a tiny little thing, which is nice.
Some people, it doesn't make any difference. And a lot of people, when they have injections of any kind, or they have blood taken, they get like a vagal reaction, so they faint. So you always, if you're giving a vaccine, in theory, you should be sat on a chair with arms on either side, because a lot of people don't even know they don't feel nervous. They don't even know they're going to get this reaction. Then the next minute they pass out. And funnily enough, I used to run like a family vaccination clinic years ago, just as part of my NHS work. And you would find that the most nervous about vaccines and the ones that would try anything to dodge getting their vaccination, like the annual flu vaccine, would be the really big, muscly guys.
Really?
So yeah, and they'd have these little petite wives who were like, yeah, that's fine, I'll get it now. And then these big muscly guys that you wouldn't want to meet down a dark alley, they would be the ones that were absolutely terrified of having a vaccination. But I mean, it lasts 2 minutes. Think about, gosh, my children are tiny. They've had like 1,000,001 vaccines already and injections. So we've got to man up. It will only hurt for a second.
There you go. Okay, another question. When
Yeah.
we're looking at the
Gosh,
list of,
James, have you got a list of questions for me today? Is this our
yeah, pretty much.
is this our efficiency?
Everyone asks the doctor all the questions, so I'm doing a community service here. So we've got the different efficacies, but really doesn't matter. At the end of the day, we just don't want to end up on a ventilator and potentially, get rolled out of a hospital. And the numbers are, I think Italy, 500 deaths a day, France, 400 deaths a day right now. I mean, those are, I heard those numbers and I'm just going, what? That's insane numbers for something.
You're ultimately trying to eradicate the more severe strain for now. It's because this is an emergency vaccine. It's been released.
Right.
It's gone through a slightly different pathway to normal. So we're trying to prevent death and prevent severe COVID, of course.
Could you talk a little bit, Jenna, about, for instance, Pfizer was one of the first off the block, and it's an mRNA type of vaccine, which is very different than your traditional vaccines when you think about some of the things that we've had and some of the vaccines that are coming about. I know that you mentioned, and I'm going to waffle here for a little bit, but I know you mentioned the World Health Organization, and within the World Health Organization's evaluation process, there are currently 15 vaccines on that list, with only 8 that have actually been approved. No, less than 8 that have been approved at this point. So only 4 have been approved, with another 5 are in the process and getting very close to that. Within that bundle, and one of the things we talk about is COVAX. We hear about COVAX, which is this consortium for vaccines. You get people now with the vaccines that are coming out going, oh, hold on, I want the Oxford. No, I want the Moderna. No, hold on, I want the Pfizer. No, hold on, I want to wait for. What's the difference between some of these different vaccines, like the mRNA and say what they're doing with the human androvirus vector-based vaccines out of Russia?
So there's 4 different types of vaccine available at the moment, and there's crossover. So you might have 2 different companies that are issuing the same type of vaccine. So the bog standard, the one that we've used many, many times, is either it's basically a real virus. However, it's either a dead virus or it's one that has passed through a few generations. So it's now so weak, it's not actually going to make you really poorly. It's not going to actually give you the full-blown, say, COVID-19 in this instance. And that's the one that a lot of people feel the safest with, because it's age-old technology. We've used it before. Can I just state that all of the vaccines that are available at the moment, they're actually older technology than maybe we're aware of. So I think even myself did a recall when I heard about, say, Pfizer, for instance, with the mRNA, which I'll explain in a second, because we think, oh gosh, it's brand new, therefore it's unsafe. Actually, these have been tested many, many times and for many, many years. It's just that it's not been mainstream vaccination, so it's not something we're aware of. So as I say, that's the virus. It's a real virus, or it's a dead virus, and it's very weak. And basically what it does is the body sees the virus, learns to identify the virus, and produces antibodies against it. So although this virus doesn't make you unwell, when you meet the real virus in the future, your body recognizes it a lot quicker, makes the antibodies a lot quicker, and you can rid it before it starts to take hold of you.
And these are the tried and true vaccines that we're talking about.
This is the really old, that's the most old school. Okay. The other 3 all have the same idea. Well, all of them have the same idea. On top of every single virus is what's being now called a spike protein. I know as an antigen. And it's almost like wearing a really identifiable hat. So say you had a particular hat that everyone in the whole world could recognize you from, then that's what all these are trying to show you, is that virus's hat. And then therefore in the future, your body can recognize that hat and say, that's COVID-19's hat, I best make some antibodies against it. So the other one that uses a virus is it's a virus that houses mRNA. So it's a virus that houses the genetic code to make that hat. So therefore your body sees the hat but through another virus, if that makes sense. And again, it's a weak virus. It's not one that's going to affect you. The other is a virus that just happens to, it just is the hat. So there's no virus, but it's just the hat. Okay. And then the last one is, say, for instance, the Pfizer, which is the most new, which is just the genetic code for the mRNA. So it makes your body effectively will make its own hat so that you can identify it and kill it. Does that make sense? I've never used actually the analogy of the hat before, but
Yeah,
it's
that's a
just
good idea. So that's really interesting that with the Pfizer one, that it's training your body to make the hat. The big question, and this is always the one that comes about. So you got these different technologies all working in slightly different ways to get to the same goal of protecting us. So you can't really mix and match vaccines then. I couldn't go for an old school one and then say, oh, I'm going to get my second shot of another vaccine.
It's not recommended. However, I think if you haven't, to be honest, even in skincare, sounds silly. Even in skincare, if someone's using one product from one company, so they cleanse with one and they tone with another, it's not ideal, because the idea is just they'll all work ever so slightly differently, and you want to use the same brand throughout the whole process so that you get number 1, 2, 3, 4, and 5 onwards, etc.
Right.
However, if you have moved country and you've had one vaccine, but that vaccination is no longer available in the UAE, then it is acceptable to go and get a different vaccine, because ultimately you're just trying to get enough hats that your body can recognize it enough, produce enough antibodies, get your memory cells so that when you identify that in the future, you can make as many antibodies to get rid of it quickly. So although they are different technology, ultimately all they're doing is showing the body a hat, and a viral hat, so which is the spike protein that everybody is referring to. So slightly different, all known to work enough so that you are not going to get severely unwell with COVID, and they all actually have the same idea. And so far, despite a lot of mass media attention, the ones that have been tried, the ones that have been tested, the ones that have been rushed, in theory, we say rushed through the process to have emergency approval, they actually just have the money behind them to be approved quickly enough. So normally there's a lot of waiting and delays in order to seek approval from the right authorities. This has had the money behind it to be put through very quickly, and there has not been any severe side effects so far that have been spoken of. And if you look on the WHO or the CDC, they group all the vaccines together with regards to talking about approvals and talking about who can and can't have the vaccine.
Interesting. All right, that's really important. And I mean, the sort of the end goal here is get a vaccine at this point. Like when you're looking at all this, is there any doubt in your mind about getting vaccinated?
Of course, it's different, isn't it, this time? It's not like we're going for our MMR jab that's been around for many, many, many years, and that people that may have had it when they were younger are now in their old age and have not been affected. It doesn't matter what you read, what science you come across. It's still a little bit unnerving, the fact that it's been rolled out quickly. People can tell you why. So like I've just said, it's an administration thing, it's a money thing. So it's not had the barriers to being released as quickly as things would have been done previously. But it's still, you're still going to have maybe a seed of doubt. Some people don't. Some people are so frightened of COVID that they don't have that seed of doubt. And that is also appropriate, especially that some of the newer strains that are coming in are seen to affect younger people, healthier people with no previous medical conditions. However, it doesn't matter. It can still make you feel a little bit uncomfortable. However, I think it's also going to be completely unavoidable. If you're somebody that wants to travel, attend an office, go and pick up your children from school, I can just see around the corner it's going to be. You can do so when you've got your vaccination card. So I think it's going to be an inevitable part of life that you have got to have your COVID-19 vaccine. So
do you think, though, are you worried as a medical practitioner that when people get vaccinated, they're going to think, I don't have to social distance as much. I don't have to think about hygiene as much. I don't have to wear a mask as much. Do you think we can develop a false sense of security? Do you think that other stuff's still going to have to stay in place?
Well, in theory, if you get rid of COVID-19, so say it's now completely eradicated, it takes us back to the beginning. And there's one part of me, there's a 50% strand of me that thinks, gosh, I hope it does go back to normal. I hope people do relax a little bit and we learn to hug each other. We learn how to shake hands. We learn that it's okay to have coughs and colds here and there in order to have that human interaction that we had before. There's the other 50% strand of me that thinks, I hope that we've learned the value of hygiene and that we learn it's important to wash our hands as regularly as we have been, to teach children how to be more aware of the surroundings and more hygienic. And also how great to go to a soft play here in Dubai, and it looks, you can see your face in the, you know, the pads that your children are jumping up and down on, they've got their hands on. I really hope the world is as clean as it is right now. So I'm torn, James. I think somewhere in the middle would be appropriate. What about you? What do you think? Because you've definitely got OCD. So how do you feel?
Oh no, I'm keeping the mask on for now. I think just because I've had the vaccine, I've been vaccinated, doesn't mean that I can't shed, and I might not have a reaction. But I'm very concerned that I'm shedding, and I don't want to potentially shed and infect someone else. And
sorry, that's different. You're referring to just with COVID. I thought you meant sort of worldwide generally.
Oh, no, but the other side of it is I'm kind of thinking, you know, I've traveled to Asia in the past and to all sorts of far-flung places, and I've often seen a lot of people wearing masks, and I kind of gone, what's that all about? And now I'm kind of going, what a good idea. and
as a health professional, I think we're going to have masks for the rest of eternity within workplace.
Well, and the other one is, I don't know if anyone's been to Malaysia or been to Bangkok or any of these Asian countries where you have food halls, which are spectacular. What do you see there? And this is what the West is missing. You go to a food hall in some of these countries, some of them third world, and there's sinks and soap to wash your hands all available. You don't have to go find it. You don't have to go into a washroom, hunt it down. It's all there. So I think hygiene, I think people are going to become a lot more aware and think a lot more about it. I think that's a good idea. I think that's just, let's do it.
It's not that I have the issue with. I think I agree with you. Fantastic. Absolutely brilliant. You know, food poisoning can be really catastrophic. It can actually kill people. Sometimes people are very unaware of that. My issue is tactile manner at which we've been denied.
Been wrong.
You know, being able to walk up to somebody, shake their hand, give them a hug, especially good friends, people that are, in fact, there was something released on Facebook today. It was a friend of a friend who had lost her son and was saying what a lonely grieving process it has been for them because they've not been able to hug their friends. And I think as well, because I'm quite a tactile person, and some people do need that sort of, you know, touch from someone else, and like I don't know, like put your arm around someone that you've not seen for a while. I think that's really important, and I hope we don't get so paranoid about the mild infectious diseases that we are able to go back to a bit more how it was.
Yeah, I'd like to see some. I'm like you. I'd like to see a sort of a halfway mark, and I think we're at least thinking about it, which is kind of good. And I think we've also developed some paranoia, haven't we? Anytime someone coughs, you're like, whoa, what's going on there? Anytime someone sneezes, oh, what's going on there? But the positive side that I think has come from all this, Jenna, is if someone is feeling sick and has got the flu or something, now you're forced to stay home and take a sick day. Whereas in the past, how many times have you been in an office where you've got someone who clearly needs to not be there, needs to be at home for a few days? I'm hoping this will start to accelerate a change in workplace culture.
Yeah, and who else is going to be calling up pretending that they've got flu-like symptoms in order to get themselves a few extra days off? You know, in the NHS, everybody knew, and I'm not saying I did it, but we all knew, the ones that did, that when they said they had diarrhea and vomiting, they'd ring up and say, I've got D&V. That was then written off for 48 hours. No questions asked, because you are not allowed to be present for 48 hours after you've had diarrhea and vomiting. And we all know the people that would call up after a night out and say, oh, I've got diarrhea and vomiting, and that was then wiped off. So you also think that, I agree, totally agree with what you're saying. There's also definitely going to be open to abuse from some of the more rogue colleagues amongst us.
What do you think about some of these nasal things that people are talking about? And I mean, there's all sorts. You know, the other great thing about this coronavirus, and if you know, I'm a glass half full kind of person, so I'm always looking for the positive side. Is we're really starting to think more about alternate ways of testing stuff, alternate ways of treating things. And I just find it interesting that we're now talking about our noses and throats more.
Well, then there's in talk for a nasal vaccine, and they actually think that once it's past the line, that it could even be more effective again. And again, use that definition loosely, because it depends on what they mean by most effective. But they're looking at it stimulating a greater antibody response. I'm not sure why that is, but I love the thoughts of nasal vaccines. Again, it's because of children and the thoughts of at some point this vaccination program will get rolled out onto children. And I don't think it's pleasant for little ones to have vaccination. You can't explain it properly to them. In fact, my boys went about 6 months ago for their 3-year vaccines.
Wow.
And one of them was so excited. I mean, I told him it was going to hurt a little bit. And he was like, it'll only sting a little bit. And he was so excited. And then the look of shock and horror on his face when he realized he was having a needle. You know, if you can administer that in a different way, in a way that potentially will get an even better response, how fantastic. And you're right, James, we're thinking outside the box a little bit more, like how wonderful. And we touched on this sort of last week when we spoke. The countries have been communicating with one another and have been able to share information, which is something that we don't tend to do within the pharmaceutical industry. So how great is that?
Yeah. Hey, I want to jump back just for a second to some of these vaccines, because you must be hearing a lot of this as well. And we know that we've got different types. We've got the protein-based, the RNA-based, the viral vector, genetically modified, virus-based. I mean, it's wonderful, these words that we're hearing. Every single vaccine that I'm looking at, except for the one that is coming from Janssen at this point, is a 2-doser. And that one also, the Johnson & Johnson one, is tied in with that, where they're talking possibly just a 1-doser. What I'm hearing more and more, and I'd love to get your take on this, is different jurisdictions, different countries going, you know what? If we only give 1 dose, we're still going to hit that efficacy of the people not ending up on their deathbed. What are your thoughts on that?
James, I mean, I get the idea, and I think a lot of countries are deciding to try and immunize as many of the population as possible with that first dose, rather than thinking we'll take a cohort of the population and make sure they've got the double dose because they're the more at risk. Yeah. I don't think at this stage is a right or a wrong, because there's just not enough information. So I personally, I'd probably agree with the former comment to say let's try and get everyone vaccinated at least once, so then at least everyone's got some antibodies against COVID. But that's not backed with research. That's just backed with common sense and my personal thoughts and opinions on it. But everyone will have their reason, and it doesn't mean that any reason isn't valid. It's just that they're different reasons, and people are all holding on to slightly different information at the moment. So I kind of think at least if you can get the first vaccine, that's better than nothing. It's like when we talk about exercise, doing a half-hearted workout is better than nothing at all. So why would we not try and get some immunity going there? It might not be enough to totally immunize you against every strand of COVID, against the less severe strains of COVID, and to still have a response, but maybe not as bad a response. But at least you've got something for your own protection. It might not protect those around you, but at least it will protect you.
I want to go back to something you said right at the start, and that was talking about the amount of information that's out there and the amount of information that is being rehashed and recast and is versions of the original information. And for me, as someone who teaches media, I've just stopped listening to some of that stuff. I've just tuned it out, and I've said, you know what? I'm going to go look up the WHO material. I'm going to go look up what the British government is saying directly and get their information, as opposed to letting a journalist read it and tell me what it says. I'm going to go get that press release document. I'm going to get the French stuff, or the countries that I trust. Maybe it's Canada, maybe it's the US, maybe it's Australia, but get it directly, give it a little read. You can get on their email lists and get their press releases and their press packages. And I'm going to start making up my own mind, because I realize that some of these journalists, and I work in that profession, they don't have a clue what they're talking about. I mean, truly, they're doing a disservice to you and me.
It's awful, because I once wrote a blog called Medical Media, or Medical Media Monstrous Hysteria was what was entitled. There have been some really amazing aspects of medicine that have now become obsolete because the media have taken a viewpoint on them and ruined the population's opinion, made people quite angry about things that are really very excellent and have wonderful ideas for patients. And people have now, they don't want it and they're frightened of it. And it's all thanks to the media and because it sold some newspapers, which I find completely disgraceful. Personally, I use only 3 sources for anything to do with COVID, really. I'll read other things, but the ones that I will then relay to other people are the CDC, so that's the Centers of Disease Control and Prevention, based in America, the WHO, which is sort of like worldwide, based in Switzerland. But both of those will take information from all around the world. And the third one is from the Royal College. So, for instance, different specialties in the UK will have the Royal College of General Practitioners, the Royal College of Obstetrics and Gynecology. These are the 3 people that I will then relay information to. They are trustworthy, they are non-biased, and they just have the best interests of the population as a whole at heart. They are not people that are sponsored in any way. They do not receive funding to do certain things. And it's not, they're not media. They will have public relations officers who will try and sell things potentially in a polite and familiar way. But the information is sound and it is from research only. So I think be very careful what you read. Read them if you want to, like I do. I read them. You've got to make your own viewpoint on them. But ultimately, just be careful and do look ultimately at the trust sources, such as those. Who do you go to, James? Like, who's your go-to?
I like the CDC. I like the Royal College, and I like to listen to Dr. Tam in Canada. So looking at the Canadian government's information. So yeah, and I guess we ultimately generally and the World Health Organization, of course. I think we all tend as nationals from somewhere to revert back to our own countries as well. So I like to get a little bit of a nicer little load. And it's funny because, you might say the CDC, well, Canada, the US, we're right beside each other. We have different views on a lot of things, different medical systems, different ways of approving or disapproving things. And they're different systems. And I think looking at a nice bundle of trustworthy sources and not getting the 2-step flow theory where I'm getting the information from someone else who's processed it for me. I want to do a little bit of that processing myself to make the decisions. And I mean, more times than not, when I've read something from the WHO that a journalist has said, well, the WHO says, or Tedros has said, Dr. Tedros has said, and you kind of go, hold on a second. That's not what he said. I watched it. I read it. That's not what he said. They've decontextualized it. And so I think it's really important that we, and you said it, use your common sense and in this case, do that little extra due diligence on thinking about things.
And the one thing to sort of go away with, because we've talked about vaccines, so we've sort of skimmed them, haven't we? We've given it a sort of a general overview, is that if you were to just spend your times on social media, it would seem that there's an awful lot of people that cannot have the vaccine. That is so not true. It's so not true. You might have your own personal reservations. I mean, I've admitted I feel a little bit touchy because it's just come out very quickly, but I console myself with the science and from trusted colleagues and from those trusted sources that this is the right thing to do. And there is nothing that out there to suggest that we shouldn't do it. And as I say, majority of this, even if we're told it's quite new, brand spanking new technology, it's actually not. Is that most people can have the vaccine. If somebody is a little bit different, so someone's diabetic, they're immunosuppressed, they're taking hard-hitting drugs like methotrexate, you can still have the vaccine. It's just slightly moderated, and that's something for you to discuss with your doctor about how you take the vaccine, how you moderate your medications before and after the vaccine to still have it. And actually, these are the people that need it the most. Right. There's nothing to suggest pregnant women should not have it. People are thinking about having children should not have it. The only people that are a definite no for the vaccine are people that are allergic to the ingredients. And again, that depends on what particular vaccine you go for. So if you're somebody that's had an anaphylactic reaction, that is a life-threatening allergic reaction that happens within minutes of having a vaccine in the past, go and do your homework, speak to your doctor about that particular vaccine that you're looking at getting. They are the only people that are an absolute no for that vaccine. And to be honest, majority of the vaccinations currently with COVID do not have the major ingredients that tend to cause these anaphylactic type reactions. So again, it's pretty much open to 99.9% of the population.
So it's time to get active. Jenna, this has been a lot of fun. I gotta say, I hate to have to cut us short, but you know what? Informative, educational, entertaining, and Neve is sleeping. You see, she's the quietest baby in the world.
You nearly kicked off before, James. I've been doing some vigorous rocking with my left arm.
Jenna, thank you very much for this. And I really appreciate you taking the time to share your thoughts on vaccines and more. I hope people feel a little bit more at ease. And thank you very much. Doc Talk with Dr. Jenna Burton right here on Podaholics. We'll do it all again real soon. Thank you very much for listening.